Homeless people going through healthcare systems face a number of difficulties, but the one which comes up time and time again is the repetitiveness in which they have to share their information, talk about what's going on. If you are asked constantly to keep repeating yourself, you have the feeling no one's actually listening. And it's very difficult to get people who are living on the streets, who are homeless, with a whole range of issues to actually engage in the first place. So ultimately you want a health system that is geared up to encouraging people to stay there and not give them reasons to feel that they're not being listened to and heard.
In fact, being homeless is a very busy occupation. You are worrying all the time. Where's your next fix going to come from? Where's your next friend going to be? Where are you going to get any food? Where might you sleep tonight? So actually going to the doctor or going to a hospital is another big issue, and there's plenty of reasons why you put it off. And then you only go when you're in an emergency and you're carted in by an ambulance, and then that's bad news.
There are 14 specialist homeless health services in London, and those services collectively felt that we should get together to come up with a standard of assessment that was holistic and thorough, and meant that all of those services were asking the same questions and not missing out on anything in terms of, for example, addictions, mental health, public health, those kind of things. So EMIS have given a lot of their time free to make that work.
I think the template that we're developing with EMIS actually is trying to mean that somebody's care journey through healthcare system is much more seamless. So information is passed regularly from consultant to doctor to practice to patient.
Well, for me, EMIS has been a great saviour. So it gives us secure records which we can track and we can follow, we can give decent outcomes of what we're doing. The EMIS template is actually set up in very easy little pages. So the first one is a bit about their social history. So what created their homelessness, why are they, how long have they been homeless, or are they threatened with homeless, and where were they before? All those details, because every story is different, but we want to collect to get a whole picture of what's going on.
Healthcare professionals see people that are homeless and haven't historically necessarily thought that helping people into housing is their responsibility, but with the Homelessness Reduction Act and also with this template, it just helps people to think about, okay, it's not my responsibility to get them housed, but maybe I should be referring them to an outreach team or doing something simple, because at the end of the day, housing is a health issue.
They've come into a system where they're having to relate, they're having to talk, and this is an opportunity to say, okay, well, let's take this crisis and make it count.
I've got extensive lived history of rough sleeping, and if there was a method of being able to convey my information, my patient data, ahead of time, before I made it to appointment, if I made it to appointment, or making sure that those records were up to date, I think it may well have speeded up, expedited my journey out of homelessness.